Hello everyone. So the topic which we're going to see today is liver. So liver is more of a discussion topic. So in liver they might ask short notes like ligaments of liver and microscopic structure of liver. So we'll see those in detail now. So the objectives of today's class are we're going to see the location of liver, the external features of liver, the lobes of liver, the ligaments of liver, so which is a short note, the relations of liver, which will be useful in discussion, and the bad area of liver, which is of important clinical significance, and then the microscopic structure of liver, which is again a short note, and some clinical correlations. So now into the topic. So what is liver? As we know, it's an important vital organ where many chemical reactions takes place. So this liver is the largest gland of our body. Okay, so liver is the largest gland of our body. So there are some main functions that are being carried out by the liver. So what are they? So the liver secretes bile and stores glycogen. So since the liver is a gland, it might be an exocrine or endocrine, right? So the liver here is both exocrine and endocrine. So what is the exocrine activity that is being carried out by the liver? It secretes bile. So this is the exocrine activity of the liver, okay? It synthesizes serum protein and lipid. So this is the endocrine activity of the liver. Then what's the next function? It detoxifies blood from many toxins that are being circulated in our systemic circulation. So what's next? Liver produces 𝗵𝒵𝒿𝗂𝗀𝗃 cells during the fetal life. Okay. Then the next thing, this is the liver, as we can see here. Okay. The location of the liver. So in the abdomen, okay, in the abdomen, we have 9 quadrants. Okay, so when we draw like this, okay. Okay, so what we have over here, we have 9 spaces over here. What are they? So this central region consists of umbilicus. So this region is called umbilicus. This region is epigastric region. Okay, so this region is epigastric region and this region is hypogastric region. This region is right iliac fossa and this region is left iliac fossa. Okay. Okay. So this region is right hypochondrium and this is left hypochondrium. This is right lumbar and left lumbar. Okay. So what is the location of the liver from this diagram? So the liver occupies completely the right hypochondrium, epigastric region and left hypochondrium to some extent, right? So what is its extent in left hypochondrium? So this is clavicle. So when we draw a line over here, this is called the mid-clavicular line. So over the in the left hypochondrium, it extends up to the mid-clavicular line. Okay. Okay. So now what's next? We'll see the shape and size of the liver. So the liver is wedge-shaped and it is red-brown in color. So what about the weight? So the liver is around 1.4 to 1.8 kgs in male and it weighs around 1.2 to 1.4 kg in female. So in newborns, it's around 1/18th of the body weight of the newborn. Okay. Next, what are the external features of the liver? So the liver has 3 well-defined external features. Okay, so they are the diaphragmatic surface, visceral or the inferior surface, and then the inferior border. So this inferior border is a sharp line, okay, that separates the diaphragmatic surface from the visceral surface. First, we'll see about the diaphragmatic surface. So this diaphragmatic surface, okay, so this is the diaphragmatic. So we'll get oriented to this diagram first. So this is the anterior part. This is the anterior direction and this is the posterior direction. So this is superior and this is inferior. Okay, so this is the diaphragm. So the part of liver that is being covered by the diaphragm is called the diaphragmatic surface. Okay. So from this diagram, what is the diaphragmatic surface then? So this part, this whole part is diaphragmatic surface, right? So as we can see here, diaphragmatic surface is convex, right? And it is very extensive. Like where are it projected? So it projects forward, right? It projects forward, to the right, backward. Okay, so all these regions. So now, so what about this diaphragmatic surface? So this diaphragmatic surface is very smooth. Okay, it's covered by peritoneum. So this yellow colored layer, right? So this is the peritoneal covering. So here we have a layer that is not being covered by the peritoneum. Okay, so this area, this layer, or I mean this area is present in the diaphragmatic surface, but in the posterior part of the diaphragmatic surface that is not being covered by the peritoneum. So this part is in direct contact with the diaphragm, right? So this layer part is called the bare area of the liver. Other than this, the diaphragmatic surface is covered completely by the peritoneum. Okay. Then, what are the features of the diaphragmatic surface? Okay, so this is the diaphragmatic surface. Okay. So what are the features? We have ligaments. Okay, what are the ligaments present over here in the diaphragmatic surface? We have the coronary ligament. Okay, so we have the coronary ligament and the so this is the coronary ligament. Okay, so this is the coronary ligament and the right triangle. So this is the right triangular ligament and this is the left triangular ligament. So what is coronary ligament? It's like a crown, right? So this coronary ligament is like a crown. It is present superior to the liver. So the coronary ligament is present over here and we have the right triangular ligament over here and the left triangular ligament over here. Okay, what's next? What's the other feature over here in the diaphragmatic surfaces? We have a groove for the inferior vena cava. Okay, so this is present left to the bad area. So we saw in the previous diagram, right? A part that is not being covered by the peritoneum. So that's called the bad area. And this is the bad area. So this groove for inferior vena cava is present left to the bad area. Okay. We'll move on to the next surface. So that's called visceral surface or inferior surface. As the name indicates, the surface is related to most of the visceral organs of the abdomen. Okay. So this surface is concave in nature and it is directed downward. Okay. So the visceral surface is separated from the diaphragmatic surface by this thin, sharp inferior border. Okay, what are the features in the visceral surface? So this is the gallbladder. Okay, so we have fossa for this gallbladder over this visceral surface. What are the other features over here then? We have the fissure for ligamentum teres. Ligamentum teres is a true ligament of the liver, which we'll see in the forthcoming slides. Okay, then we have the porta hepatis over here, which is an inverted L-shaped structure. Okay. These are the features in the visceral surface. Next, we'll see about the inferior border. So what we saw earlier about the inferior border, it's a sharp border, thin border that separates the diaphragmatic surface from the visceral surface, right? So this inferior border is rounded or laterally over here, okay? So here it separates the right lateral surface from the inferior surface, okay? And then this visceral surface anteriorly over here, okay, it has notch for the ligamentum teres, okay, and then over here it has some it has a notch for the gallbladder, so that's called the cystic notch. Particularly in gallbladder, it's for the fundus of the gallbladder, okay. Then we'll see the lobes of the liver. Okay, so the main lobes of the liver, okay, so they are the right and the left lobe, okay. So the lobes of the liver varies when we see from the diaphragmatic surface and from the visceral surface. So I'm saying from the diaphragmatic surface, the liver is divided into right and left lobe by the presence of falciform ligament. So what is falciform ligament? We'll see that next. So a small introduction about falciform ligament is that it is present exactly in between the right and the left lobe over the anterior surface of the diaphragmatic surface. Okay, so this falciform ligament connects the liver to the anterior abdominal wall. Okay, so the falciform ligament separates or it demarcates between the right and the left lobe in the anterior surface over the diaphragmatic surface, right? Now, on the visceral surface, so what we are seeing over here is the visceral surface, okay? Over the visceral surface, the liver is divided into 4 lobes, okay? As we can see here, the liver is divided into 4 lobes, right? So this is the right lobe, this is the left lobe. That was common for both diaphragmatic and visceral. What we have here is the extra lobe. So this is the caudate lobe and this is the quadrate lobe, okay? So these are divided by the fissures that are present over the visceral surface, or some fossa or fissures over the visceral surface, okay? So how are they separated? So we have the fissure for the ligamentum teres over here and fissure for the ligamentum venosum over here. So what we have over here, we have the fissure for the IVC or groove for IVC, okay? And here we have the fossa for gallbladder. So the quadrate lobe, oh, here we have the porta hepatis. So now what is the boundaries of the quadrate lobe? To the right, we have the fossa for gallbladder. To the left, we have the ligamentum teres, fissure for ligamentum teres. Inferiorly, it is bounded by the inferior border of the liver, and superiorly, it's bounded by the porta hepatis, right? So, here, okay. This is the caudate lobe, okay. This caudate lobe is present above the, so here will be the porta hepatis, right? So this caudate lobe is present above the porta hepatis, okay. Right to the groove of IVC and left to the fissure for ligamentum venosum, okay. Now we'll see the hepatic segments of the liver. So for this, okay. Okay. For this hepatic segment of the liver, we'll first divide the liver into 2 lobes. Okay. The first thing is the we'll divide the liver into right. Okay. So this is the right, and this is the left. Okay. So we have first separated this into 2 lobes. Okay. So the right lobe, okay, so the right lobe of the liver. So we'll get some general introduction about this hepatic segments. So these are the structural units of the liver. Okay, so there are around 8 hepatic segments. Okay, so we'll see how these 8 hepatic segments are being derived. Okay, so this right lobe is divided into. So this is the right lobe, right? So this right lobe is divided into anterior and posterior. So over here, this is the anterior and here is the posterior. Okay. So this left lobe is divided into medial and lateral. Okay. So this is the medial and this is the lateral. Okay. Now, again, okay. So these parts are divided again by a plane into upper and lower part. Okay. So when we see here, okay. Okay. Now, what about the, so now we'll come from the left side. Okay. So left, we saw that the left lobe is divided into a medial and lateral, right? So this is the medial and this is the lateral. Okay. Again, what we saw, a plane divided this into upper and lower lobe, right? So numbering these hepatic segments. So this is the first hepatic segment, second hepatic segment, okay, and then here third hepatic segment, and this is the fourth hepatic segment. Okay, so this is regarding the left lobe. What about the right lobe then? The right lobe, we divided them into anterior, right, and the posterior, right, anterior and the posterior. Again, those were separated by a plane into upper and lower, right? So what we saw here, 1, 2, 3, 4. So now we have to number from 5 to 8, right? So this lower lobe is called the 5th and this is called the 6th, okay? And then here we have the 7th and this is the 8th hepatic segment, okay? So what's the course? It goes from 1, 2, 3, 4, okay, 5, 6, 7, 8. Okay, so it's like an L shape. Okay, so this is the order of numbering of the hepatic segments. Please remember these numbers. So these numbers are very important during the resection of the liver. Okay. Okay. Now we'll move on to the next topic, which is the peritoneal relation of the liver. So the liver is almost completely covered by the peritoneum, but there are some exceptions, but there are some areas that are not covered by the peritoneum. So there are around 5 areas that are not covered by the peritoneum. So what are they? So bare area of the liver, okay, as we saw, it is present over the diaphragmatic surface. Okay, then fossa for gallbladder, okay, it is present in the visceral surface. Okay, then we have the groove for IVC, groove for ligamentum venosum, and the porta hepatis. So all these 5 layers are not being covered by the peritoneum. Okay, next, the next topic is ligaments of the liver. Okay, so these ligaments of the liver can be separately assessed in short note. Okay, so please have some more detail. I mean, please pay attention to this. So there are 2 types of ligaments in the liver. Okay, so one is the false ligament and the other thing is the true ligaments. So first we'll see about this false ligament. There are around 5 false ligaments. So what are false ligaments? As the name indicates, these are very familiar. Okay, so just an example is enough to prove what are false ligaments. So lesser omentum. So under the topic of peritoneal folds, you might have seen lesser omentum is a peritoneal fold. So it's coming under the topic of false ligament. So the false ligaments are peritoneal folds. Okay. So we have totally 5 false ligaments. What are they? Falciform ligament, coronary ligament, triangular ligament, right triangular and left triangular ligament, and lesser omentum. Okay, we'll see them one by one. So what is falciform ligament? So this falciform ligament is a broad and the thin peritoneal ligament. Okay, so this attaches the liver to the visceral surface or visceral aspect of the anterior abdominal wall. So over the anterior abdominal wall, we should be precise over its starting point, right? So from the umbilicus. Okay, where does it end then? It ends in the diaphragm. Okay, so this falciform ligament attaches the liver to the anterior abdominal wall and the diaphragm. Okay, the next thing is the coronary ligament. Okay, so this coronary ligament lies over the superior surface of the liver. Okay, and inferior to the diaphragm. Okay, so this coronary ligament has 2 layers. Okay, one is the upper layer and the other one is the lower layer. We'll see this. Okay, so this is the falciform ligament. So it rises from the umbilicus. It connects the liver to the anterior abdominal wall and the diaphragm, right? The next thing is coronary ligament. So see, this is the coronary ligament. It lies over the superior surface of the liver. So it has 2 surfaces. Okay, the upper layer is reflected from the diaphragm, whereas the lower layer is reflected from the upper end of the kidney. Okay, we need not go very deep into those layers, but we'll see what happens when we trace these coronary ligaments. So when this coronary ligament is traced on the right side, it is continuous with the right triangular ligament. Okay, so as we can see here, the coronary ligament is continuous with the right triangular ligament on the right side. Okay, what about left side then? So on the left side, when this coronary ligament when traced on the left side, the upper layer is continuous with the right layer of the falciform ligament. So this falciform ligament is again divided into right and the left layer. So there will be a slight logical thing that would hit you right here. How could right layer of the falciform ligament is continuous with the left layer, left side of the coronary ligament? It is. Okay, we'll see about the left layer of the falciform ligament next. Okay, so the right layer of the falciform ligament is continuous with the left side of the coronary ligament. Okay, then the right triangular ligament. Okay, so this right triangular ligament is it's a small peritoneum, right? It's a small peritoneal fold. Okay, so it connects the diaphragmatic the right lateral surface. Okay, so the right lateral surface of the liver to the diaphragm. Okay, so this right triangular ligament, when this right triangular ligament reaches, I mean this right triangular ligament also do have upper and lower folds, right? So when the upper and lower fold meet at its apex, it encloses the bag area of the liver. What about the left triangular ligament? Here comes the left layer of the falciform ligament. Okay, so the left triangular ligament connects the left lobe of the liver to the diaphragm. Okay, so when the left triangular ligament is traced to the left side, both layers of the left triangular ligament comes in close contact with each other. When this left triangular ligament is traced to its right side, the upper layer is continuous with the left layer of the left triangular, falciform ligament. Okay. Next, the lesser omentum. Okay, so what is lesser omentum? It is a fold of peritoneum that connects the lesser curvature of the stomach to the porta hepatis. Okay, so the porta hepatis of the liver. Then we'll see about the true ligaments. What are these true ligaments here in the liver? The true ligaments here in the liver are the embryological remnants of the fetal structure. Okay, so we have two true ligaments. What are they? One is ligamentum teres hepatis and the other thing is ligamentum venosum. So what is ligamentum teres hepatis? So this ligamentum teres hepatis is the obliterated left umbilical vein. Okay, so this extends from the porta left branch. So see, this is the left branch of the portal vein, right? So it extends from the left branch of the portal vein to the umbilicus. Okay, what about ligamentum venosum then? So see, as you can see here, this ligamentum venosum has some connection with the inferior vena cava and portal vein, right? So this ligamentum venosum is the remnant of obliterated ductus venosus. So what is ductus venosus? We can say from this image, it connects the inferior vena cava with the left branch of portal vein in the fetal life. So the remnant of the ductus venosus is the ligamentum venosum. Okay. Now we'll see the relations of the liver. So liver, as we know, is can be demarcated into diaphragmatic and visceral surface, right? So first we'll see about the diaphragmatic surface. So the diaphragmatic surface, in the diaphragmatic surface, we have three surfaces. Okay, one is the superior surface. Sorry, this is the superior surface, this is the anterior surface, and this is the right lateral surface. So first, this is the superior surface, right? So the superior surface has convex right and convex left part. So these part fix into the dome that is being made by the diaphragm. Okay. So what is this diaphragm separates the liver from? It separates the liver from the lung and the pleura. Okay. So here, over here, we have the central depressed region of the diaphragm. So this corresponds to the central tendon of the diaphragm. Above the central tendon, we have the pericardium of the heart. So here, this region is called the cardiac impression. Okay, that's all about the superior surface of the liver. Next, moving on to the anterior surface of the liver. Anterior surface of the liver is related to the xiphoid process and the anterior abdominal wall. Nothing much more than that other over here. Then right lateral surface. Okay, so this right lateral surface, okay, is completely covered by the diaphragm to its whole extent. Okay, other than that, the right lateral surface can be divided into three parts. Upper 1/3, okay. This is upper 1/3, once again. Okay. Upper 1/3, middle 1/3, and lower 1/3, right? So this upper 1/3, middle 1/3, and lower 1/3 has varying relations over these three regions. The whole extent of this diaphragm is covered by the, the right lateral surface is covered by the diaphragm. Okay. Other than that, it has varying relation with the ribs. Okay, ribs, pleura, and the lungs. Okay. Now we'll see about the upper 1/3. Over here, we have the upper 1/3 surface of the upper 1/3 right lateral surface is related to the right lung, right pleura, and the diaphragm. Okay. The middle 1/3 surface of the right lateral surface is related to the right costodiaphragmatic recess, okay, of the pleura and the diaphragm. The lower 1/3 is related only to the diaphragm, not to the, sorry, neither the lung nor the pleura. Then we'll see its relation with the ribs. Okay, here we have the eighth, we have the relation of the eighth rib. Okay, here we have the 10th rib and here we have the 11th rib. Okay, then okay, then we'll move on to the posterior and the visceral surface. Okay, posterior and the visceral surface of the liver. So this surface, we have many relations. Okay, first we'll see about the posterior surface. So this is the posterior surface, okay, and this is the visceral surface. Visceral surface is related totally to the visceral organs, right? So the visceral surface is also known as the inferior surface. So first we'll see about the posterior surface. What do we have here? We have the bare area of the liver over here, which is being enclosed by the right triangle. See, this is the right triangular ligament, right? As we saw earlier, the right triangular ligament encloses the bare area of the liver. Okay, then what do we have? We have the groove for IVC and the caudate lobe. All these things are present in the posterior surface of the liver. What about the visceral surface of the inferior surface of the liver? The inferior surface of the, okay, so we'll come from here, okay. Here we have the esophageal impression, okay, and then here we have the gastric impression, okay, and then here we have the duodenal impression, okay. Then particularly here we have the pyloric impression and here we have the duodenal impression, okay. Then here we have the gallbladder, right? So here we will have the fossa for gallbladder. What do we have here? We have the colic impression over here, which is formed by the right colic flexure, which in turn is formed by the large intestine. Okay. Then what do we have over here? We have the right renal impression, which is formed by the right kidney. And here we have the right suprarenal impression. Okay. So right suprarenal impression is not very prominent, but it's over here. Okay. Then bare area of the liver. So what is this bare area of the liver? As we saw in the earlier slides, bare area of the liver is present in the posterior aspect of the diaphragmatic surface. So this area is not covered by the peritoneum. So what is its result? It is in direct contact with the diaphragm, which separates it with the right pleural cavity. Okay. So this bare area of the liver encloses the right extraperitoneal subphrenic phase. Okay. So we'll break this words. Subphrenic is, phrenic is diaphragm, right? So it is related below the diaphragm, so subphrenic space. What about right extraperitoneal? It is not covered by the peritoneum, so it's extraperitoneal, and it is present on the right side, so it's right extraperitoneal subphrenic phase. So this bare area of liver provides a site for anastomosis of venous capillaries between the liver and the diaphragm. Okay. So see these layers, this is the peritoneum. Okay. So this is covered by the peritoneum. So this is the barrier. It is in direct contact with the diaphragm. Okay. See, this is the bare area. So all these layers are being covered by the peritoneum. So as we can see, it's somewhat smoother. Okay. But this area being not covered by the peritoneum is rough in appearance, and we can feel the roughness over this area. Okay. Next is the blood supply. So arterial supply is by the hepatic artery and portal vein. You might wonder why portal vein, but more than 75% to 80% of the blood supply to the liver is provided by this portal vein. Okay. Then venous drainage. So the venous drainage is by 3 veins. It's by hepatic vein. Okay, that we are very sure of the hepatic vein. But in the hepatic vein, it's particularly of left, middle, and right hepatic vein. So here, okay, so this is the left middle and right hepatic vein. So the left hepatic vein, okay, it drains. It is, it lies between the medial and the lateral segment of the left lobe. The middle hepatic vein is between the right and the left lobes, and the right hepatic vein is between the anterior and the posterior segment of the right lobe, which we saw over the hepatic segments over the, in the previous slides, right? So it is related to that. Okay, so in summary, it's by three veins: left hepatic, middle hepatic, and right hepatic veins. Okay, then what about lymphatic drainage? So we have superficial and deep lymphatics, right? So the superficial lymphatics are present over the capsule of the liver. Okay, so the superficial lymphatics from the posterior aspect of the liver is drained into the posterior mediastinal lymph nodes. Okay, what about the anterior? From the anterior aspect, so the anterior aspect, the superficial lymphatics are drained into the hepatic nodes that lie around the porta hepatis. Okay. Then what about the deep lymphatics? So the deep lymphatics are present around the portal triads. Okay. Then nerve supply. So what about nerve supply? Sympathetic supply is provided by the celiac plexus, and parasympathetic fibers, parasympathetic supply is by the hepatic branch of the anterior vagal trunk. Okay. So factors maintaining the position of the liver. So there are supposed to be, there needs to be some factor that helps in maintaining the position of the liver, right? So what are they? Hepatic veins, okay, which connect the liver to the inferior vena cava, and then the intra-abdominal pressure that are present in the abdomen. So what causes this intra-abdominal pressure? By the abdominal muscles, okay. And then the peritoneal ligaments, which we saw earlier, the false and the true ligaments, right? So these three things helps the liver to maintain its position. So the next thing is the microscopic structure of liver, which is an important short notes. Okay, it's a very important short note. So we'll see what does the microscopic structure of liver looks like. Okay, so in general, okay, so the liver consists of hexagonal lobules. Okay, so this is it's a very basic point. So the first point would be the liver consists of hexagonal lobules. Okay, so what are these hexagonal lobules made of? These are made of, so these brown color cells are hepatocytes, right? So these are radiating from, this is the central vein. Okay, so let's see what is present over this hexagonal lobule. Okay, so over the periphery, okay, over the corners of the hexagon, there are 6 corners, right? So we have the portal triad at each corners of the hexagon. What is this portal triad and what are they made of? The bile duct, the portal vein, and the hepatic artery. These three things contributes to the portal triad, and these are present at the each corner of the hexagon. Okay, and this present over here in the center is called the central vein. So what are these what is this hepatic lobule made of? This hepatic lobule is made of radiating hepatocytes from the central vein to the corners. Okay, then so the hepatocytes, okay, so these hepatocytes are separated by spaces. Okay, so those are called sinusoids. Okay, so as you can see here, these are sinusoids. So this is the spaces between the hepatocytes. Okay, so this sinusoids connects the portal vein to the central vein. Okay, so blood from the periphery to the center is carried through via the sinusoid. Okay, so the sinusoid, okay, so the sinusoid is lined by some endothelial cells, which can be macrophagic in action. So the macrophage cells in liver is called the Kupffer cells. Okay, then the liver secretes bile, which is its exocrine function, right? So the bile secreted by the hepatocytes are drained by the bile ductules. Okay, so bile ductules, and then it drains it unites to form the main bile duct. Okay, then we have two things. One is the portal lobule and the other thing is the hepatic acinus. So what is this portal lobule? So we'll take this for instance. Okay, so This is the portal lobule. So what are its corners made of? It's made of central vein. Okay, so it's a triangular structure. Okay, so this portal lobule is a triangular structure whose corners are made up of adjacent central vein. What about acinus, portal acinus then, or hepatic acinus then? It's a diamond-shaped structure, okay, which is formed in between two central vein and then two portal triad. So opposite central vein and then opposite triads. Okay, let me join these things. This is the hepatic acinus. Okay. Okay. Now we'll see the development of the liver. Just a point. The liver develops from a liver bud. Okay. Then we'll see about the clinical correlation of the liver. So segmental resection of the liver. Okay. So in case of cancers, okay, so the liver needs to be resegmented or it needs to be removed. Okay. So the most commonly resected segments of the liver are 5, 6, and 7, 8, which are the right lobe of the liver, right? So these are the most commonly resected parts. So even when 80% of the livers, when they are removed, the liver can regenerate because it has high capacity, or I mean the hepatocytes have high capacity of regeneration. So what is the duration of growth? The liver it regenerates within 6 to 12 months. The next thing is the needle biopsy of the liver. So in case of liver abnormality that is being seen via CT, MRI, CT, ultrasound, okay, in those cases when we see a liver abnormality or when we see persistent liver abnormality in the liver blood test, that is we have some changes in the liver enzymes, okay, or when we need to stage the hepatitis B or C, we ask the patient to undergo needle biopsy. Okay, so this needle biopsy, where does this needle is being inserted? Okay, so this needle is being inserted in the mid-axillary line, okay, through the 9th or the 10th intercostal space in the right side. Okay, 9th or the 10th intercostal space in the right side. Okay, so what are the structures the needle pass through? The chest wall, yeah, the costo-diaphragmatic recess of the pleura and the diaphragm. Okay, and the needle reaches the right anterior intraperitoneal space. Okay, so here from here we'll take the biopsy. Okay, then we will not insert the needle into the 8th intercostal space, since we know that when we insert the needle into the 8th intercostal space, we know that we are going to injure the liver. The next thing is the cirrhosis of the liver. So the cirrhosis of the liver is very common in alcoholics, okay, or when during injury which is caused by toxins, infections, okay, and poisons. So these things causes the cirrhosis of the liver. So the liver cells, I mean the hepatocytes, undergo necrosis, okay, and then it undergoes death. Okay, so first thing, the hepatocytes are replaced by the fibrous tissues. Okay, so the fibrous tissues result in the cirrhosis of the liver. Yeah. Okay, so the fibrous tissues. Okay, so the patient, when these when the normal hepatocytes are being replaced by these fibrous tissues, the patient develops the obstruction of the bile flow, right? That causes the jaundice. Okay, and we'll have the increased pressure in the portal vein, so that causes the portal hypertension. Okay, that's all. Thank you.